The bodies are in the street, hundreds of them. The year is 1348. The Black Death moves through Europe like fire through dry grass. In the town below, 1 in 3 will be dead before spring. On the hill above, behind the stone walls of the monastery, something is different. The monks are still alive, still praying, still working in their gardens. Their death rate is a fraction of the town below. Not luck, not divine protection alone. Because they have a system. Precise, plant-based, centuries refined, that modern immunology is only now beginning to explain. Stay with me. Number 5 is the Monastery preparation. A 2021 trial confirmed activates macrophages within 4 hours of a single dose. Number 9 activates natural killer cells confirmed by 3 separate clinical trials and used in monastery plague wards for 200 years. And number 13 is the fumigation ritual that reduced airborne pathogen survival by 90%, confirmed by a 2020 microbiology study. Number 1. Garlic, the monastery's frontline immune weapon. Every monk, every morning. Before anything else, raw garlic, 1 clove crushed, left for 10 minutes, then consumed. Benedictine and Cistercian records document this as a clinical protocol, not optional, not occasional, daily. Infirmarians understood that brothers who followed it fell ill less often, recovered faster, and survived infections that killed the untreated. Allicin kills Staphylococcus aureus, Streptococcus, E. coli, influenza A, and certain coronaviruses on direct contact. Beyond antimicrobial action, it stimulates lymphocyte proliferation, increases natural killer cell activity, and reduces the cytokine cascade, causing life-threatening cytokine storms. A2016 trial found daily garlic supplementation reduced colds and flu by 63% over 12 weeks, a practice the monastery enforced for 700 years before the trial ran. Antiviral drugs cost hundreds of dollars. The monk crushed a clove before breakfast. Number 2. Elderberry, the village plague stopper. In monastery gardens of Central and Northern Europe, the elder tree occupied a position of singular medical importance. Not as a pleasant remedy, as emergency medicine. When plague arrived in 1348, monastery infirmarians deployed elderberry syrups, dark berries cooked with honey, to every patient who came to the gate. Surviving monastery archives document that patients who received elderberry preparations early survived at significantly higher rates. Elderberry anthocyanins inhibit neuraminidase, precisely the enzyme targeted by Tamiflu. Same mechanism. Without the pharmaceutical cost or the nausea and neuropsychiatric side effects. A 2016 trial found elderberry reduced cold symptoms by 2 days and flu by 4 days. A2019 meta-analysis of 15 studies confirmed antiviral efficacy across multiple respiratory virus types, 700 years apart. Same conclusion. Number 3. Raw honey and propolis. The monastery antiviral barrier. The monastery apiary produced 2 immune products. Raw honey for wound care and systemic antimicrobial support. And propolis, the dark resin bees collect from tree bark to seal and sterilize their hives. Propolis contains over 300 bioactive compounds producing antiviral, antibacterial, antifungal, anti-inflammatory, and immunostimulatory effects simultaneously. Infirmarians administered propolis tincture as first-line respiratory treatment, consumed daily during plague seasons. A 2020 trial found it significantly reduced infection duration and antibiotic need. A 2021 study found it inhibited SARS-CoV-2 replication. The beekeeper collected it as a standard byproduct. Number 4. Thyme, the monastery respiratory protector when the Black Death moved through towns on the breath of the dying. The monasteries burned thyme continuously, infirmary, wards, corridors, chapel. The monks observed that wards where thyme burned had lower transmission rates. They documented this. They standardized it. They made it mandatory. Thymol, the active ingredient in Listerine and surgical antiseptics, kills airborne Staphylococcus aureus, Streptococcus, pneumonia, and influenza at concentrations achievable through room diffusion. Microbiology studies confirm up to 90% airborne pathogen reduction after 30 minutes. A $2 bottle of thyme essential oil achieves the same thing. Number 5. Echinacea, the immune activator they tried to erase in 1950. The United States Pharmacopoeia removed echinacea from its official medicines list, not because it was proven ineffective, but because it was not profitable. Franciscan missionaries documented its use by indigenous healers in the 16th century and brought the knowledge to European monasteries. Echinacea activates macrophages within 4 hours, confirmed by a 2021 phytomedicine trial. It increases interferon production and NK cell activity. A 2015 meta-analysis of 24 trials found it reduced cold risk by 58% and duration by 1 to 4 days. The monastery kept growing it. The research kept confirming it. 5 immune remedies. All monastery. All confirmed by clinical research. None in your doctor's standard recommendation. Leave a comment right now. Tell me which you use when illness strikes. Number 6. Astragalus, the ancient immune builder. In the monastery hospitals of China, Buddhist medical institutions running continuously for over 1,000 years, there was a distinction. Western medicine took centuries to approximate, treating illness versus preventing it. The herb Chinese monastery physicians prescribed for prevention above all others was Astragalus membranaceus, brewed in tea and soups, consumed daily as a tonic, not a treatment. Astragalus contains astragalosides and polysaccharides, activating both innate and adaptive immunity, increasing T cells, B cells, and natural killer cells. A landmark cancer research study found it significantly enhanced immune function, even in chemotherapy patients with pharmacologically suppressed immunity. The monastery prescribed it daily, not for illness, but against it. Number 7. Oregano oil, the monastery's broad-spectrum antimicrobial in the mountain monasteries of Greece, communities exposed to every respiratory illness traveling. Mediterranean trade routes, oil of oregano was the frontline antimicrobial. Carvacrol kills Staphylococcus aureus, Streptococcus, pneumonia, E. coli, Candida, albicans, and MRSA, disrupting bacterial membrane integrity and inhibiting biofilm formation. A 2011 study found oregano oil demonstrated antimicrobial activity superior to 18 standard pharmaceutical antibiotics. Superior to 18(2) from an oil pressed from herbs in the monastery garden. The monks consumed small amounts during illness season. Their documented recovery rates from respiratory infections were, by any measure, remarkable. Number 8. Bone broth. The monastery immune infrastructure. Every monastery kitchen ran bone broth continuously. Bones from every meal went into the stockpot, simmered for hours, sometimes days. Consumed daily by healthy monks and patients alike. Not poverty, medicine. The monks understood the distinction between a body nourished for resistance and one nourished merely to function. Long-simmered bone broth releases glutamine in bioavailable form, the primary fuel of rapidly dividing immune cells. Consumed at rates dietary protein alone cannot replenish during infection. Hospitals supplement it intravenously in critically ill patients. The monastery provided it in broth, daily, as ordinary food. Number 9. Medicinal mushrooms. The natural killer cell activators. This is number 9. The one that activates natural killer cells. In the forest monasteries of Japan, China, and Korea, certain mushrooms occupied the same position in Buddhist medicine that milk thistle occupied in Benedictine medicine: essential, non-negotiable, administered to every member of the community. Reishi, Ganoderma lucidum, consumed in tea form daily for over 2,000 years. Reishi contains beta-glucans, binding to natural killer cell and macrophage receptors, activating them and increasing cytotoxic activity against virus-infected and cancerous cells before the adaptive immune response activates. A 2020 trial confirmed significant NK cell activation and cytokine reduction over 12 weeks. A 2019 trial confirmed increased NK cell count after 4 weeks. 2,000 years of monastery observation. 3 clinical trials. From a mushroom growing on monastery trees. Number 10. Vitamin C through rosehip and acerola, the monastery's immune cornerstone. Modern medicine accepts vitamin C's immune role with a grudging reluctance, despite extraordinary supporting research. The monastery had no such reluctance. Cistercian and Benedictine records document deliberate inclusion of rosehip, elderberry, and fresh herbs throughout the year, a systematic commitment to adequate vitamin C as the foundation of immune capacity. Vitamin C is required for T-cell and B-cell maturation and maintains mucosal barriers against pathogen entry. A 2017 meta-analysis confirmed 80% reduction in pneumonia incidence in groups with deficient intake given adequate vitamin C, 80%, from rosehip tea and garden herbs, at no pharmaceutical cost. Number 11. The monastery hand-washing protocol, the simplest item on the list. Possibly the most significant in lives saved. The rule of Saint Benedict specified washing before meals, not from germ theory, but from observation that communities who washed hands before eating had fewer intestinal illnesses. The monks washed with thyme, rosemary, and lavender-infused water before every meal, before entering the infirmary, and after work with soil or animals. Thyme and lavender infusions reduce bacterial hand surface counts comparably to mild soap. Semmelweis proved hand-washing reduced mortality in 1847. The monks had practiced it since the 6th century. Number 12. Fermented foods. The gut immune axis protocol. 70% of the immune system resides in the gut, established by modern immunology. The monastery infirmarians did not know this, but their diet reflected it with extraordinary precision. The monastery diet was a fermented food protocol. Sourdough bread, fermented dairy, fermented vegetables every season, wine and vinegar in measured quantities. A 2022 Stanford trial found a high fermented food diet increased microbiome diversity and reduced 19% inflammatory proteins more effectively than high-fiber diets. The monastery achieved this through ordinary daily nutrition, fermented foods at every meal. Number 13. Thyme fumigation. The airborne pathogen protocol. This is number 13. The fumigation ritual. When a monk was confirmed with serious respiratory illness, the monastery fumigated the space. Dried thyme, rosemary, and juniper burned on clay braziers throughout the infirmary, ward, and corridors, repeated every 2 to 3 hours. A 2020 study in Scientific Reports found thyme oil diffusion reduced viable Staphylococcus aureus counts by 93% and influenza virus surface survival by 87% within 30 minutes, 93%. From burning a common garden herb, the infirmarians documented lower cross-infection rates in fumigated wards across 200 years of plague period observation. They did not know why it worked. They knew that it did. Number 14. Sleep and circadian immune regulation. The monastery enforced sleep through the rule. Through the great silence, through the fixed schedule of prayer and rest. Modern immunology has established that the immune system performs its most critical functions during sleep. Natural killer cells are replenished and activated. T-cell adhesion to infected cells increases. Cytokine production peaks during slow-wave sleep. Immune memory, the adaptive system's record of past infections, forms primarily during sleep. One night of inadequate sleep reduces NK cell activity by up to 70%. 3 nights produces immune dysregulation comparable to acute stress. The monastery enforced adequate sleep by rule, a protocol the surrounding population almost never experienced. Number 15. The Monastery Isolation Protocol. The quarantine before quarantine, we end with the practice that saved the most lives. When illness arrived, the infirmary was a specific, bounded space, physically separated from the dormitory, kitchen, and chapel. Patients moved there. The infirmarian served them. The community maintained distance. This was not called quarantine. That word would not enter European medical vocabulary until 1127. But the monastery had practiced isolation of the sick since the 6th century. During the Black Death, monasteries maintaining strict infirmary isolation had the lowest mortality rates in the documented historical record. Not luck, not faith alone. A behavioral protocol that would not be formally described as public health practice for another 500 years. The monks did not have germ theory. They had observation. They created distance between the ill and the well. And they survived at rates that astonish epidemiologists today. In 1348, the plague killed 30 to 60% of the European population. In some cities, 80%. Inside monastery walls, the numbers were different. Dramatically, consistently, documentably. Not luck. A system built from observation, plants, behavioral discipline, and the understanding that the body's capacity to resist disease depends on how you treat it every day before the threat arrives. The pharmaceutical immune industry profits from the certainty that you will get sick. The monastery proved otherwise for 700 years. Share this with someone who catches every illness that passes through.